Harris County Hospital District Prop A was passed overwhelmingly by voters. That means big changes are coming to LBJ and Taub hospitals. Joining me now to discuss is Dr. Ismail Porsa, President and CEO of Harris Health. Good morning, Dr. Porsa.
Good morning. I hope you can hear me.
I can hear you great. You're doing awesome. So tell us what area is going to benefit from Prop A? Because we're basically talking about like northeast Houston, right?
Well, actually, it's going to encompass the entire Harris County and City of Houston. Let me explain how. You're right. Majority of the bond is going to go towards creation of a new level 1 trauma center on the LBJ campus, which serves the northeast corridor of Harris County. But part of the bond proposal is also going toward expanding the capacity at Taub Hospital, our existing level 1 trauma center hospital, and also creating 3 net new community health centers in Harris County and replacing some of our old clinics. We have 4 clinics today that are over 50 years old. So it really impacts the entire Harris County and City of Houston.
Those are really in need of renovation. That's understandable. But I really want to explain to people that for comparison, other cities the size of Houston have sometimes 4 or more level 1 trauma hospitals. For the city of our size, we have 2. So what is another very large hospital, something that's designed for maybe mass casualties? What is that going to do for the people of Houston?
Yeah, and thank you for that. First of all, it's really difficult to find a city the size of Houston. But the closest I think right now is Dallas, with a population of about 2.5 million, and they have 4 adult level 1 trauma center hospitals. So you're right. Harris County and City of Houston needs more than just the 2, realizing also that the 2 hospitals are attached to each other. So really, we have 1 large level 1 trauma center trying to serve the entire Harris County, a very large geography. So yes, adding another level 1 trauma center, but also the level 1 trauma center is going to be outside of the Texas Medical Center, makes it possible for folks in the north, northeast, northwest Harris County, if they are victims of severe trauma, motor vehicle accident, gunshot wound, stabbing wound, they won't have to be driven all the way to the Texas Medical Center or flown into the Texas Medical Center. They can receive the same level of services on the LBJ campus. God willing, everything goes well in late 2028 or early 2029.
Yeah, we're looking at about 5 years out. And, when we talk about Houston, everybody thinks of the medical center, and we're the largest medical center in the world. But, yeah, there are parts of Houston that are still medically underserved. And, it leads to, like you said, having to go to the medical center from possibly far away if you've had something this traumatic happen to you. And we know that ER wait times are atrocious. Current emergency rooms are constantly busy, and it takes a long time to be seen. Is this going to relieve any of that?
Exactly. I mean, today, this is just a great example. LBJ Hospital today has over 80 exam rooms in our emergency room. Today, this morning, they were housing 45 patients who were waiting for a hospital bed. They have been admitted to the hospital, but they're still inside our exam rooms in the emergency room, waiting for a hospital bed.
Yeah.
Well, as you can imagine, that backs everything up. People can't get to the emergency room to see our providers. So yes, this will definitely impact the ER wait times.
Dr. Porsa, I know we have to let you go, but just one more thing. In addition to hospital care, what types of services will we also expect to come out of this Prop A getting passed?
Sure. Thank you for asking that question, because $500 million investment is going towards our community health centers. So as I mentioned, 3 new clinics, but also adding capabilities and additional services to our existing clinics, so that when people show up to our clinics, at the end of the day, we won't have to tell them, go to the emergency room because we can't provide you with X, Y, and Z. So we really want to shift focus from hospital care to health promotion and disease prevention in our community clinics.
Yeah, I think, thank you very much, Dr. Ismail Porsa, President and CEO of Harris Health. All very wonderfully said. I appreciate you joining us this morning.
Thank you for having me.